Nobody knows the trouble I've been through. Nobody knows like he does. Nobody knows the troubles I've been through. Nobody knows like Jesus.
Here we go.
We ready?
Recording? Yes.
Cyber Health Podcast.
Cyber health. And put my reading glasses.
Mm-hmm.
Red leather, yellow leather. Red leather, yellow leather. Pick a piper, pick a pepper. Okay. Welcome to the Cyber Health Podcast. I'm Stephen Pirano, your host. We're excited for this episode. The gentleman across the table from me is none other than Arthur E. Palamara. He's a vascular surgeon. He's an Italian-American, and I'm proud to call him my friend. You might have recognized him. He was here about a year ago on the podcast. He gave us a lot of great information. And since then, I've had many requests to have him back. So here he is. We figured out our schedule. Welcome to the podcast, Doc.
Steve, it's a pleasure to be here. I am honored. I am not famous, however. I want you to know that I just do the best job that I can. And you admitted all the scars on my back from suffering all of the injuries that I've sustained trying to do what you tell me that I'm doing. Thank you.
Thank you, Doc. Before we get started here, we will bounce around on this interview just to give a little bit of taste of what we're going to discuss today. We're going to, of course, talk about healthcare. We're going to talk about the bureaucracy and the politics in healthcare. And then we're going to touch on some topics that some people may consider controversial. But that's what podcasts are for, or to communicate, get the message out, and get the dialogue going. So, again, thank you for joining us. As we mentioned before in our previous podcast, I've been in healthcare for over 20 years. You've been in healthcare for over
47 years and 19 days. Actually, a little bit longer than that if you include medical school and my residency training. Well, that played a role. And I had quite a varied experience, which maybe you want to talk about later on, too.
We will. But let's go after some critics here real quick, because a man of your stature, you've been in healthcare 47 plus years. You played a role in politics in your career, and you're also an outspoken patient advocate. So with all that being said, it has to come with some sort of challenges. You can't have all fans, right? There's going to be some people that challenge you. So let's get right out there and say, okay, what do you say to the critics when people say, okay, enough's enough, Dr. Palamara, when you're hanging it up? You've been 47 years. What's the deal?
Well, I get that question asked more and more, and I will hang it up when I no longer find it interesting, when I don't get the gratification out of it that I put into it, when I feel that I can no longer really have an effect on the outcome. There's two sides to that story. One side is the patient care, which I still very much enjoy, and unfortunately, corporatization and external forces make that more difficult to accomplish, which is a challenge that I'm going through right now. And the second part of that is the advocacy, working through organized medicine with the American Medical Association, trying to achieve a goal, a stated goal. And right now, our fragmented, corporatized healthcare system is really in a quagmire, and unfortunately, the patients are getting the short end of the stick, although they're paying out their nose.
Absolutely. And I can attest personally, working with you, I just hit 10 years at Memorial, and for the last 10 years, I have worked with you from time to time. And even more recently, it just so happened we worked the last 2 days in a row. And I'm saying this on my own accord, that you are an excellent surgeon.
Well, Steve, please, I don't do compliments well. I'm more accustomed to being criticized. If you want to criticize me for the next 45 minutes, please feel free to do so, because I'd feel a lot more comfortable.
Okay. But that being said, it is true. He is a man who shows no decline whatsoever, and I want to say that in front of him, even though he just made that comment, it is true. And he's not asking me to say that. And I work with other physicians that are nearly half his age and can't hold a candlestick to this gentleman. And I say that with respect for those people. They are professionals. I'm a professional myself, and I hold you in high regards as another fellow professional. But more importantly, as I mentioned earlier, you're sitting across from me above anything else because you're a patient advocate. And I value that because I have been a patient. I've had family members that have been patients. And you want someone across from you, when you're that patient, a gentleman like this man here. And not only that, more so because words are words, right? But I want to put things into action. And so, Dr. Palamara, respectfully, we're going to prove right now just how well this gentleman is.
I'm getting worried.
He's going to prove to us right now his skill level.
It does.
And he can.
It'll work?
It works, Doc. And you pick whatever you want
Okay.
and just show them how you can easily help this patient out.
You sure you don't want to talk instead of do this?
Oh.
This is not really like what it's like, incidentally. And by the way, the pickups that they have in here are terrible.
They are terrible. I apologize.
Well, you didn't make the game. I thought that this was one of the tariff things they couldn't bring in from Vietnam. No, am I wrong?
That's right.
But by the way, I
This
just
is the
want to
last
warn you.
one.
One more compliment, and I'm going to leave.
Yes, sir.
Okay.
Okay.
we got that.
Yes, sir.
I'm not doing too well here.
Okay.
Not holding on. There we go.
Beautiful. See that? Right there.
Okay.
Nothing else to say.
That was the wishbone.
We just silence all our critics. Okay?
Good. Like
All right.
critics. Yes, sir.
Yeah. But moving on. We want to go back to what you mentioned, something about your upcoming and your healthcare education at St. Luke's Hospital. There was something that we had spoke about off record that you want to talk about.
Yeah, well, right. I tried to bring out some very interesting vignettes. St. Luke's is a marvelous hospital. It's still in New York. I think it was taken over by Mount Sinai, though, but it was a great experience. I did a year of anatomic pathology with one of the world's greats, and then I went back into surgery, though. But some of the experiences that I don't think your listeners probably are aware of, some of the patients that you have to take care of. So there was one Friday night where this guy came in with a gunshot wound of his abdomen, probably in his early 20s, good-looking guy. So my job when I was covering the service at nighttime was to go around and check all the post-ops, make sure they're doing good. Well, he was in kind of an isolated part of the hospital. So I walk into his room, and there's a woman in bed with him, which, at this point, you don't really get too upset about, at that point, rather. So you need something to decompress the bowels. It's called a nasogastric tube, because after you do an abdominal operation, the bowels don't work for 2 or 3 days. It could regurgitate and come up and go into your lungs. So you need that. Well, he had pulled it out. So I said, sir, we need to put that back in, being bright-eyed and bushy-tailed and young and enthusiastic. So, and I go to try to do it. He says, you're not putting that back in. So I said, sir, you're really going to need that, because I'm trying to be as polite as possible. Whatever. And then he says, you're not putting that in. At which point, he pulls a gun out from underneath the pillow. And he says, you're not putting that in. So I was the only person around there. There's nobody else there. So I said, if you don't want it, I'm not putting it back in, but I think it's really in your best interest. He says, listen. He said, I'm from Columbia, the country, not the university. And he says, and a couple of years ago, you may have heard about me. I said, oh? He says, yes, I was in the nose wheel of an Avianca jet as it was taking off. And as it took off, I fell out of the nose wheel down into a freshly plowed field, which saved my life. And I said, yes, I have heard about you. And I said, sir, if God loves you that much, I'm not putting the nasogastric tube back into your nose. You're perfectly fine. So those are kind of like the accommodations that you have to make when you're in training.
Wow.
Yeah. That was a famous man.
Yeah, absolutely.
I wonder if he's still alive. You don't really survive very often if you're
No.
falling out of a jetliner
No, absolutely
doing a couple
not.
hundred miles an hour.
After all these years being in practice, what motivates you the most?
Doing a good operation. You were with me yesterday when we were operating. That was my third operation. The carotid endarterectomy that we did went absolutely fine and so forth. And the patient who had several complications before actually did very well. And then the second operation was equally difficult. And when you're able to accomplish a challenging operation and have a successful result, and the patients do well, you cannot really achieve any higher level of satisfaction than that. So it is kind of like maybe Beethoven creating a symphony, or Chopin with a piano piece or something, but it is a tremendously, you have a high doing that. And maybe
Sure.
I'm addicted to that high, and I still enjoy that. It kind of lifts your day, and you can get through all the other injustices that you are faced with as the day goes on. That's why I still like that.
That's great. And then the opposite to that, what would keep you up at night, typically nowadays?
Complication. Unfortunately, everything that we do does not turn out successfully. It was, some cases are just, you can't really help people very much. In vascular surgery, usually it's the loss of a limb, but people do die from time to time. That's the reality of it. All of my patients are very sick. They're what they call ASA. It's an anesthesia ranking 3 or greater. 5 is the level. So everybody that I take care of is sick. I really am very frustrated when somebody comes in with a little small spider angioma, a little teeny-weeny varicose veins in the legs, claiming that's causing their pain. That's not the sort of patient I like to take care of. You know, the sicker the better. I've always enjoyed intensive care unit work, and taking care of very sick people is my challenge.
Right, right.
I guess God gives us different talents.
Right, yeah. And how early on were you in your career to realize that's one of your talents?
Pretty early, when I was at Harlem Hospital, actually. I just enjoyed taking care of the people in the ICU more than anything else. You're pretty much on your own in a place like that. That was very early in my career. The first internship I did was in medicine, which I hated. And then the second was in surgery, which at Harlem, which was completely different. I mean, Harlem was just a out-of-this-world experience. And I imagine people that work in inner city hospitals still find it very similar to what we went through back in the early 70s.
Wow, yeah. A man of your stature, who do you admire? Who do you look up to?
That's a good question, because the higher you go, you wonder how you got there, and then after a couple of years, you wonder how other people got there. I would have difficulty answering that question. There are a lot of people that do things. I think I admire a person that makes a sacrifice to do what's right, and we certainly don't see that among our elected officials these days.
Right.
I mean, my hero, I think, is Robert F. Kennedy Jr. I'm sorry, Senior, no, Junior is.
Mm-hmm.
You know, I'm suspicious of anybody that have worms in their brain. So,
Right.
Robert Kennedy.
Right.
I hope I don't offend anybody, but I think some of his decisions have been contrary to the public good.
Right. And our goal here is not to offend anybody intentionally. It's just to have a conversation. You did mention earlier about the bureaucracies in healthcare and the direction they are now compared to where you first started out. So I want to give you a direct question. More importantly, what is really the big difference between a physician that is in private practice to an employee physician?
Having been in both, and being now again in private practice, and then having been employed for about 12 years, the problem is that people that employ physicians have no idea what's going on at the grassroots level. They have no idea the technical requirements that are necessary for us to achieve a good outcome in the operating room. You do, because you're standing there and you see it all. They don't. They never spend any minute. There's the Lawton Childs used to be the governor of Florida, a senator. Who was the senator from Florida? I'll think of his name in a second. But anyway, they used to spend a day working with people in different occupations. They used to spend a day doing Bob Graham to find out exactly what the common guy goes through, so they could make better legislation, so they could govern people better. So the hospital administrators have no idea whatsoever. They just look at the numbers at the end of the month. They see how many successes they had, how many operations were done. So if you're an employee, and I feel sorry for the hospitalists because they are really put under a lot of pressure. They want to get the people in and get the people out. If we get them better, so much the better, but at least we're able to collect for that service. So you have these hospitalists, and the people that run it, the administrators, have no idea of the cognitive effort that goes into taking care of a good patient. So you've got somebody, let's say, who's 80 years old, has been in a hospital 10 times in the past couple of years. You've got a whole myriad, a stack of x-rays you've got to look at, CT scans, and find out what other people are thinking. And they expect you to do that in 30 minutes. So if you are expected to take care of a patient in 30 minutes and you have, let's say, 6 admissions, and you can't really do a good job. Now, to the good, you have computers which kind of synthesize some of that information for you. But you have to go beyond the level of the superficiality and find out what really took place with that patient. If you don't do that, you're doing the patient an injustice. And that goes on every day at our hospital because people are having pressure put on them where you've got to do all these admissions. So some of these doctors, good people, very sincere people, have to go home and spend a couple of hours after they get home just going over these records to make sure that they didn't miss anything. And it's very easy to say, well, it can't be important. It's not there. The second problem is that you have individuals who are not going to push back, and they will just do the minimum amount of work that you possibly can. And as long as you do relative value units, so many a month, then administration is happy. So that they don't look below the surface. Now, you asked about private practice. I went into private practice, I don't know how. In 1982, I had 2 kids at the time, had a wife, I had a mortgage, and I have no idea how I had the guts to do that. But it was easy then. I got up at nighttime. I got a consult at 11 o'clock at night. You drive out. I was on a staff of 7 hospitals. I survived by putting in temporary pacemakers, by putting in Swan-Ganz catheters, by putting in a lot of other devices. And it paid the bills somehow, and it kind of took off. Working with insurance companies was easy then. Mm-hmm. Now it is an unadulterated nightmare. So for me to try to get back now on some more of the panels for the insurance companies is going to be incredibly difficult. But I'll be changing my practice affiliation probably at the end of August, and exactly how it's going to work out. To the good, I've led a very frugal life, so I don't really have to worry about income at this point, so I can just go ahead and practice medicine to my own advantage. But working with insurance companies has been horrible. They are worst, and I think that they are one of the scourges of our civilization. The corporatization of healthcare and the unethical behavior of insurance companies is something that this country needs to do something about immediately and drastically. Can I go on?
Yes, I just want to ask you to interrupt you with one question to just emphasize as far as the responsibility of a surgeon as an employee. So just to break it down for people like myself who don't understand the severity of the situation. So for an example, if I'm a surgeon and I'm employed by X hospital, am I required to do a certain amount of surgeries per month? And am I evaluated on that?
Well, not so many a month, but there's a book, shall we say, a standard that's written by Millman and Roberts. And they look at, let's say, all the vascular surgeons in the United States. And they divide it up into RVUs. So let's say that doing a open aortal bifemoral bypass carries 10 RVUs. I don't really know what it is, but something like that. And doing a fistula on an arm carries 1 RVU. So they look at it and they say that the surgeons in the 50th percentile did 500 RVUs per month. Okay? Mm. So they want you to be performing at the 75th percentile, let's say 750 RVUs per month. So even though, let's say, you are the greatest surgeon in the world, you are a trauma-trained orthopedist, and very few people have your capability or your ability, you're down here at the 25th level, they say you're not producing. So they try to fill up that void by making you see patients in the office. Well, if you're on call for the emergency room and somebody comes in with a pelvic fracture and you've got 30 people waiting to see you in the office, you got to leave. But so the way that they define work product is very ill-suited, ill-defined, and not advantageous for the physician. So to try to say they want to make physicians work harder, which one of the political appointees recently said, we want to get rid of the lazy doctors, I don't think that they have any concept at all of what goes into being a doctor. And I think that they ought to take a page out of Lawton Child's book, maybe spend a day in the hospital, see what actually goes on, see what's actually necessary. I think they would be much better informed. Having said that, I would like to say, too, though, that not everybody is able to receive the best of the ultimate in healthcare. And I'm going to speak very honestly because the individual I'm going to be talking about has spoken about his illness extensively. So it happens to be the current president of the American Medical Association. He was at a meeting of the AMA in November of last year, and he had an event where he was unable to speak for about 5 minutes. And he was disoriented, so they said, you got to get help. So anyway, he went ahead and he went to the Mayo Clinic where they diagnosed a brain tumor. So brain tumor, they operated on him. They couldn't take it all out in that particular case. So they put him on a medicine. that is going to cost $250,000 per year. It's about 25, I forget how much, a staggering amount of money, which was approved by his insurance company. So in my conversation with him, I said, but the average person is not going to get that, because there's no way that the insurance company is going to pay that amount of money, nor can they afford to pay that amount of money to take care of everyone. So other people then are relegated to either obsolete, older, or non-functioning treatments. So how does one reconcile the excellent health care which that doctor is going to receive? And he's a great guy, by the way. He deserves everything that he gets. But if he was not the president of the American Medical Association, there's no way in God's earth that he's going to get that care. So the other people are left over here. So we are faced with that challenge. In fact, I got up early this morning to prepare for the talk because I didn't want to look ignorant when I'm talking with you. So there's an article in the New York Times that said that insurance companies routinely reject 25% of the requests for medications that they receive. So how do we pay for the Ozempic? How do we pay for the Wegovy? I mean, are the pharmaceutical companies ripping us off? Why do those medicines cost a tenth of what they cost here in the United States? If you buy them in Europe, they cost 10% of what we would charge over here, with $1,000 a month. Well, there's a couple of reasons. Number one, the pharmaceuticals want to make their money. Number two, well, we have to spend money on research. So, okay, well, then they manufacture it in places like Ireland or Sweden or whatever, and they have all of these huge tax breaks. It's very complex. But ultimately, our healthcare system is based upon greed, based upon finances, based upon making as much money as the corporations as they possibly can. There's an excellent letter to the editor of the JAMA about 2 weeks ago by Anand Habib. And this guy put it in 6 paragraphs, much better than I can say it over here, though. But he put down all of the reasons for it. And ultimately, let me ask you why, to kind of synthesize with his argument. Why does health care in the United States cost twice as much as it does in any other developed country, and yet our outcomes are about 17th? I mean, unfortunately, the goals of a corporation is to indemnify their stockholders, and they want to make money. They want to look good. The goals of the hospitals also is the same sort of thing. I don't think they want to take bad care of the patients, but certainly they don't have the same individual, personal, humanistic interest that a physician should have. Not all doctors have this, I'm finding. We've kind of lost that empathy, that advocacy. I mean, it really is our physician's responsibility to stand up. So until we correct that, we're not going to really solve the healthcare mess that we have.
Now,
So,
is that happening in training with physicians, or not until they come into the corporate side and in the healthcare?
that's a very, very good question. And my answer is yes. Okay. Now, what I mean by yes over here, the people that they are admitting to medical school these days, to quote a local dean of a medical school, are brilliant, narcissistic sociopaths. That's not a good thing. That's not really a good thing at all. The chairman of the Department of OBGYN of a major medical school in the here in Florida also, too, told me that, I want to use the word their residents do not want to talk to patients and do not want to touch a patient. So how can you be an OBGYN doctor without touching or talking to a patient? I mean, it's a very intimate specialty to get into in any case. Right. So what I'm saying is that maybe their personalities are not aligned correctly with their choice of a profession. I mean, if you don't have that underlying desire to try to help someone, then you're not willing to make the sacrifices that are necessary to really be successful in your profession or to accomplish your goal. And I think that the people that they're probably admitting to medical schools fall into that category. And I don't think it's a conscious choice on their part. Now let's step back too and say that today's younger society, whatever they call them, X or Z or something, I don't know whether they have really been taught to have that empathy for another individual. I'm not sure that was part of their training, or in this very competitive world that we live in the United States right now, whether that is part of their personality structure. So it's very hard. There's no question about the fact that they're smart, And secondly, what are they being taught in medical school? Brilliant. I mean, there's things in molecular biology and so forth which I really don't understand. The whole treatment of immunotherapy for tumors, for example, and knowing how these things work, it's just brilliant. It's going to certainly allow medicine in the future to do a lot more than we're able to do right now with or without surgery. But the reality is that if you don't have someone at the grassroots level that's able to provide that care and to argue against the insurance companies to achieve that care, then the whole system fails.
We have students, professionals that watch this podcast. So let's say right now there is someone who is in school to be an administrator, a hospital administrator, and they're listening to this. Can they come out and get in an organization and change things, or no? It's way above that.
Well,
they mean goodwill.
I mean, having goodwill. Well, we've had that experience recently where you and I work, and I thought this person, unfortunately, who actually was very good and was trying to do that, who came from a different region of the country, where obviously they thought differently, was hamstrung by the board that oversaw the hospital. And again, those board members are not necessarily appointed to the board by virtue of their dedication to humanity, nor they're interested in the community, nor their interest in healthcare, nor their interest in trying to provide a service, safety net hospital. They're appointed based upon their contribution to the governor's reelection campaign, and they're based upon other attributes quite afar from those humanistic, altruistic attributes which you really need to be successful, for an institution to be successful. So when you run up against that challenge, and when you have these goals to try to do something, and it may cost money, but from their very limited perspective, being business people for the most part, their definition of success is profit. So if you have $400 million in the bank at the end of the year, you've done a damn good job. So if a couple extra people died, well, that's the cost of doing business. Sorry, Steve. Am I talking too much?
No, not at all. You're speaking the truth, right?
From my perspective.
From your perspective, absolutely, and that's what we're here to get today. So, in that aspect, how do you change things?
Well, what I'm trying to change things is trying to use my influence at the American Medical Association and in the state of Florida with the Florida Medical Association. Number one. Number two, I think we may have mentioned that I ran for office a couple of times, and I got the endorsement of both the Sun-Sentinel and Miami Herald, but the voters didn't feel that I was the proper person to represent them. So what I've done is to present very, avant-garde leaning, aggressive is the word, aggressive resolutions, which is how you do things, particularly at the American Medical Association. And the American Medical Association, I think, abandoned its leadership role. If you look at the big three right now in medicine, you have the insurance companies, which we should talk more about.
Yes, we will.
The pharmaceuticals and the American Hospital Association, and they control medicine. So who works at the grassroots level, taking care of patients? Who actually gets their hands dirty, has blood on their shirt? The doctors, nurses. When I say doctors, I'm talking more globally. Who's there at 10 o'clock at night taking care of the patient? So these groups have been entirely ignored. But the American Medical Association kind of stays at the table almost like Cinderella, maybe getting invited to the dance late, or like the birds eating some crumbs on the ground. Mm. And so they send out these circulars to us, and it says, we advocate for you, we fight for you, and we fight physician burnout by giving you life coaches to help you deal with it, instead of dealing with the underlying problem itself. So anyhow, this year I got ticked off, and I do have to confess this to you and to my listeners. I've got a very, very high level of anger. In other words, my frustration level is very low. So when I see things like happen that shouldn't be happening, I do things probably to my own disadvantage. I've been criticized quite a lot, and I got the scars on my back to prove it. Anyway, so I wrote a resolution, and the resolution asked the American Medical Association to initiate a class action lawsuit concerning the prior authorizations from insurance companies. You understand that prior authorizations have at least a 20%, probably a 35% denial rate just from the start. Okay, so anyways, I said it's about time that the AMA get off this using these soft verbs like advocate for, support, which don't really mean anything. Let's go out and do something. Let's initiate a class action lawsuit to go after these people that are causing immense harm to the patients and to the doctors and to the United States and to the hospitals too. So anyway, so that went to the Florida Medical Association, and to my surprise, they passed it. They supported it. And they allowed us at the American Medical Association delegation to represent that perspective. So it goes up there, and then we belong to something called the Southeast Delegation. I think it's about 19 states or 18 states, including New Jersey, by the way, which I didn't think was part of the South, but I guess you can.
Right.
So
Stick 'em in there.
They got that. They got their endorsement too, and 5 other states signed on to this resolution. So what it asks is to go ahead and define a class of litigants, the people that have suffered harm, and then number 2, to work with other individuals, and there's plenty of other organizations out there. Number 3, to initiate this. So this got accepted by an 80-20 vote of over 700 delegates voted. Well, we'll see how they're going to drag their feet on that.
Right.
We're going to see whether they're going to find a way to get out of that. Now, I do have to say, though, that the way it was written was to go ahead and start 1 and 2, which is appropriate, and then work with the legal center at the American Medical Association to achieve this goal. So hope we do something. And I got some more stuff coming up, too.
That was exciting. That's exciting. Well, thank you for sharing that. Well, let's go ahead and get into more about the insurance, because then we're going to switch it up a little bit. We have some fun things to talk about. You gave me some articles before, and I breezed through several of them, and I just made some quick notes. I'll mention them, and then you can just take it from there.
Sure.
So let's jump in right there to Medicare Advantage.
It's a ripoff. You're being ripped off. The Medicare Advantage plans are a game, and you, the patient, are being enormously disadvantaged. You and I heard our anesthesiologist talk about the experience that her father's facing right now. Yesterday, and that is true. They don't want to take care of you. They find that they usually they will find the cheapest provider to send you to. The cheapest provider is rewarded by how little care they're able to give you. They entice you with things like, oh, we'll give you free transportation, we'll give you free dental examination, we'll give you free eyeglasses, we'll give you a free cup of coffee. By the way, some years ago, at the FMA, when Marco Rubio was running for the Senate, he came and talked to us. So it was a Saturday morning about this time, and by the way, he's a super nice guy. I mean, I've met him, I've known him since he was in the Florida House. Super, super nice guy. If you were here right now, you'd fall in love with the guy. He speaks beautifully, very nice man. Anyway, so he gets up there and he's talking about health care. And he says, his father had lung cancer at the time. He goes to the Clinica Cubana, and they give him some coffee, and they take care of him, and everything's very nice. And so, and he says they take really good care of him. So then there's an opportunity to ask questions. So I never turned down that opportunity. Mr. Rubio, and by the way, we were dressed exactly the same, the khaki pants and the blue shirt.
Oh,
So,
wow.
Mr. Rubio, I said, how come you don't want to give the same quality of health care to the rest of the people of the United States that your father receives? So afterwards he comes over and puts his head on my shoulder, goes like that, and walks away. I haven't seen him since, but anyway, but he is a very nice man. You can or cannot agree with his politics, but at least as a personality, he's a very nice person.
So he didn't say anything.
No, I got, obviously, well, he's hemmed in. And one thing you do find out, I mean, in all honesty, being a politician is very difficult. You try to make everybody happy. You know what the right thing to do is, but if the public sentiment does not support that, you're not going to be able to achieve it. And if you've got all these forces lined up against you, you're not going to be able to achieve it. Did I answer you? I forgot. Did I answer your question?
Yes, you did.
Okay.
Yeah. Let's talk about how, hospitals inflating America, the biggest healthcare bill. There was an article there that's what the title was. Hospital inflates America's biggest healthcare bill.
Again, hospitals are having, in many regions of the country, a tough time of it, particularly rural hospitals, particularly what just happened with the big, beautiful bill of President Trump. Hospitals, particularly smaller hospitals, depend on Medicaid for about 10% of their income. A lot of them are going to close if this thing happens. We have to find other sources of income. And number 2, the hospitals, many of them are owned by by corporations like HCA, for example, that are based and have the affiliation with their stockholders and their primary interests as stockholders. So the hospitals in the United States, because of their girth and because of their expense, do not really try to do anything to lower the cost. They try to make up their expenses by charging the insurance companies more. The insurance companies, on the other hand, want to keep the prices. They can't raise prices anymore, so they want to keep their expenses down. So there is this very delicate balance, which doesn't really work. So, for example, if I have a patient that I've operated on before, and they come back into our hospital, and we don't accept their insurance, I'm not allowed to admit them. However, the way around that is something called EMTALA, which allows you to bring the patient in through the emergency room and operate on them like that. So the hospitals certainly have their own set of guidance rules, and physicians have another. And while hospitals at least state that they are trying to act professionally, the fact is that they have not yet figured out which side of the equation they're on. And that line varies from side to side. Give on to God what belongs to God, and give on to man what man deserves. I think something like that. I think I'm screwing up the Bible passage. I'm not a theologian, but you got what I'm saying.
Yeah, absolutely. Well, then that leads me into my next question. Speaking about healthcare institutions, without naming any names, we have in South Florida primarily some large institutions that are constantly competing with each other. They're stepping outside of the zone of being just a large institution, and they're offering primary care, surgery centers, one-day services, private equity acquisitions. Was two different things, right? So going on the first part, is that healthy for us to have one large healthcare organization, or is it healthy to have competition, or is that irrelevant altogether? And we're going back to what we initially talked about, where it's a business.
You cannot franchise good healthcare. You cannot franchise. I've been saying that now for 30 years. Two of your bigger players like Cleveland Clinic and Mayo Clinic and all over the United States, and they put the big signs up on the wall and so forth, and you think you're getting the same quality care. You're not. You can't do it. There's only so many good doctors to go around. Cleveland Clinic is wonderful. In Cleveland, they got some of the best heart doctors in the world there. Mayo Clinic excels at just about everything. You can't take those people and move them down to South Florida, Jacksonville, where else? Arizona, so forth. You just can't do it. There's just not enough good doctors around to do that. But they put this big sign on the wall, and they want to lead you to think that you're going to a Starbucks where there's the same coffee in every cup, and that's just not true. You just can't do it. So yeah, it's all done for the profit motive. So we have a major hospital system in South Florida, down in Dade County, and they're opening up over here. We have several, and so they open up these storefront places, these walk-in clinics, and they do provide a service. And the service is that you can't get an appointment to see your primary care doctor probably until next January, so at least you can walk in if you have a problem then and there. So the average person doesn't really know whether they're sick or not, so they want to have somebody to tell them. And so they have these storefronts which you go into. Usually the prices, by the way, this was started by Senator Scott here in the state of Florida. And it was amazing to see it's $100 to do an x-ray, it's $125 to do lab, so forth. So they actually quantitate it. And they'll do it, and they'll at least tell you correctly or incorrectly whether you have something major wrong. Correctly, we have something majorly wrong with you. Now, having said that, 90% of all illnesses cure themselves. So you go in there, you got a cough, you got a fever, you feel really sick. Maybe they do a strep test. I don't even know if they do that. Right? It's usually a virus. Mm-hmm. So they give you packages of Zithromax, and you send you home. Right? 5 days later, you feel better. Oh God, they cured me.
Right.
It's cheaper than going to an emergency room. But if there's anything, they only treat 6 diseases: 6 earaches, tonsillitis, what else? Urinary tract infections, simple stuff. And the rest of that, they just turf to the emergency rooms, where it's quite a bit more expensive.
Yeah.
We can take $10,000 out of your wallet in the first hour.
Right.
Okay, now what was the other thing, private equity?
Private equity acquisitions.
Private equity is probably one of the worst things that's ever been foisted on the American public. They go out and they buy all these things, and their goal is to try to make them run more efficiently, to make the doctors work harder, to make people receive inferior care. They make them, and then if they're not making the amount of money that they thought that they would make, they just close the shop. That happened to people that were in office next door to me, and they closed it. They were closed on November 30th and said, put a sign on the door, don't come back. If you want your records, you can stop here for the next month. After that, it's not available. Wow. So that is the way that the private equity thinks. There's many articles in JAMA, which I think I shared with you, about the ills that have been caused by private equity firms, and that they should not be involved at all in healthcare, either buying a hospital or in doctors' practices or offices. And to go further, veterinary medicine. I mean, they've gotten into veterinary medicine. The first thing they do is charge an exorbitant amount of money for the same care that you got for much less money when one veterinarian owned it. Dentist, the same practice. Now, unfortunately, private equity is based solely upon greed. They contribute nothing to the matrix, to the well-being of the United States, to any person in the United States. Another example, too, our anesthesia team that was owned by Envision was owned by a private equity firm, KKR. Is that right? Yeah, something like that. Anyhow, they couldn't make payroll, so they were taking the money away from the doctors for a while. Then they owed, I think, $2 billion. Maybe my knowledge is a bit old, so it's maybe a year from that. $2 billion, which they couldn't meet, so they divested them and wrote it off. So $2 billion went poof. So I don't really understand how that happened. But I want your listeners to understand the effects on the patients. So now you are depriving some patients of really excellent health care because some of those doctors left. Some of the anesthesiologists that are good and we had confidence in found greener pastures someplace else. And the whole process is entirely disruptive. And that does not work in healthcare. You need to build a symbiosis where people are able to form a collegial entity that provides good care. You saw it yesterday. You saw yesterday an operation where people have worked together for a long time. It's kind of like a symphony.
Yeah.
And unless we achieve that, then it doesn't work. And you're a part of that yourself, too. You know, you're the conductor, but anyhow.
Right.
You're handing us the bow and the violin.
Right, but we see it. Yeah.
I can't say anything, and I think all the articles that we found would reflect that. When a private equity firm buys a hospital, the quality of care goes down. And I dare anybody to refute that. I mean, I've got plenty of proof. I save a lot of these articles just in case there's some people that doubt what I say. Somebody came in and mentioned your podcast and asked me if I was still working for the mafia. I had to correct that notion, and that didn't do me any good. Right, Vito?
Right. Well, that's a great segue for us to go into get some levity here and have a little bit of fun while we have some time left, because that is something that I've had people reach out to me. They enjoyed that. The mafia, the Italian-American heritage, for what it's worth on that side, is entertaining, to say the least. And some people may find it disrespectful, but we know each other for a long time. This is a lighthearted segment of this podcast. We have fun. People even mention to you as, hey, when are you going to have the Mafia doc back on? And, matter of fact, Dr. Palamara, he came in here with a few bodyguards. They're in the waiting room right now. The guy looks like this, and the guy this, and he talks like this, and he got like gunpowder in his throat. I don't know. But you're a very respected man in this community. And matter of fact, I think, sure enough, same thing happened last year. I think one of the guys dropped the brass knuckles here. I don't know why. You got some clumsy bodyguards. They need to get it together. But no, we're gonna have some fun now here, and we want to talk a little about Italy. And since we actually met, there were several attempts on Dr. Palamara's life, and we want to talk about a couple of those. And Dr. Palamara is a stand-up guy. He's old school from the old country, and for you guys who understand that language, that's what we're talking about here. We're not going to get too much involved with the families, but I did want to touch on a couple of stories that you have told me about. One of the first assassination attempts was when he was in Italy a few years back with his beautiful wife. And if you want to get into that, what happened at the cafe, It
wasn't an assassination.
That's what they put in the article that I read.
No.
I don't know if you saw. Yeah.
Really?
Yeah.
No, we were in Katana, which is a province in Sicily. And we were traveling with a nurse, my wife's friend, and a friend of ours. Her husband passed away about 8 years ago, though, but she still continued. We used to travel with them a lot. So we're sitting there in this place, in this restaurant, tourist trap in Katana. Katana's a nice little town. It's also, so I speak Italian, so we're sitting there and having dinner, and the wine that I ordered was awful. So there's a couple sitting next to us against the wall, and he's a lot older than she is. And so they had given us a bottle of champagne because it was the nurse's birthday at the hotel, so we had that with us. So this girl gets up, and she walks over and says, no me cuesta champagne. Prosecco. So, she's leaning over like that, and she's looking at the bottle. So with that, I guess her accomplice, certainly not a boyfriend, reaches over and grabs our friend's purse. Of course, we didn't notice the other well covered. So they sit down, and she gets up maybe 5 minutes later to go to the bathroom, and he's still sitting there. So she doesn't come back. So maybe about 5 minutes after that, he leaves. So we go to pay our bill and to leave, and the purse is gone. So inside of her purse, passport, wallet. So it's an expensive purse, by the way. So everything. She had no money at all.
Oh.
So I said, what am I going to do? So I said, well, what you could do is you could, push the gypsies aside and stand in front of a church and beg. So I don't think people that don't travel know that, but you can't leave a country unless you have a passport. I mean, you can fly inside of the country without a passport, but she had nothing, no identification whatsoever. So fortunately, we had copies, and I travel with copies of passports, even on my phone and stuff like that. So we had to fly back to Rome the next day. I had to fly to Rome to go to the embassy to get it. Well, it worked out beautifully, though. So before that, we had to get what they call a denuncia. You had to go to the police, to the carabinieri, to get a denuncia. So the next morning, we get up, and we decide to go there really early. We take a cab or something like that to drive over there. We get there. So there are these two Italian Sicilian cops. One has a belly bigger than the other, right? And they have their uniform shirt on. It doesn't look like it's been pressed probably in a couple of weeks,
right,
like that. But very nice people. So we're talking in Italian. So my Italian is good, but it's not that good, okay? So they're sitting over there, and we're giving him the story of what had taken place. And he says, he shouldn't have gone to that restaurant. The restaurant was horrible. Everybody knows, stay away from the place. The food is terrible there. Tourist trap. He's saying this sort of stuff. So, we had looked through the pictures, the videos, to see if we could see the people. And, they both left, and you could recognize them. But I said, are you going to be able to find them? So he says, nah. He says, they probably work for somebody. I said, but la mafia è una organizzazione defunta, which means that the mafia is a defunct organization.
Right.
So the one guy looks at the other like that, and he goes like this, and he goes, yeah, so that was so we went to Rome, and then, but just by the way, it just might be of service to your viewers too, that in Rome, they can really pickpocket you really well. Two things. Number one, they're able to make a copy of your key fob to open up your car to get the stuff out if you're in a restaurant. And number two, okay, do you know where most of the pickpocketing happens in Rome? McDonald's. Because the Americans go there to buy McDonald's food, and they're not unsuspecting, so they're very slick about taking the food out. Now, my question is, why would you go to Rome, fly, 4,000, 3,000 miles to go to Rome, to go to a McDonald's? With all the good restaurants that you have there, it just doesn't make any sense to me. So if you go into Rome, don't go to McDonald's. And if you do that, buy one of those money belts to put around your belly. At least I'm providing a public service.
Right, and we appreciate that. And the second attempt, unfortunately, on Dr. Palamara's life, which he disclosed to me, was before he came to South Florida. He was working in Madison Square Gardens, and you had some boxing situation there. I don't know if it was the Gambinos, the Bananos. Somebody was there.
What happened was I worked in Madison Square Garden, I think for 6 years or something. And there was a very famous animal trainer, Gunther Gable Williams. And so it shows you stand about 10 o'clock, maybe a few minutes after that. So you stand around for another half an hour to make sure everything was okay. So I'm ready to leave at about 25 minutes after 10, ready to go home. Somebody comes to me and says, Doc, they need you out back. So I said, out back, you have to understand that the garden is built on several levels. So the doctor's office was right off the floor of the garden, but they had a big workspace, huge, that was maybe 100 yards away or something like that. So I walked back there. I said, what's going on? He says, Gunther Gable Williams wants you to help him. said, is he hurt? He says, no. There's a tiger that is in labor, and he wants you to deliver the tiger cub. So I said, so I'm looking at this tiger walking around in the cage, and she don't look happy. So I said, you want me to go in that cage and deliver a tiger?
Right.
Now, tigers ain't in the best of moods even when they're not pregnant and ready to deliver. And this tiger was certainly not a happy tiger, And she, whatever, growling, something like that. So I said, Mr. Williams, with all respect, tigers are born every year by themselves in the jungle without a doctor around.
Right.
There is no way I'm going inside that cage. Right. But no, I was not an assassination. Maybe you consider it an assassination.
Right. And that was the last day you worked there, right?
No, it was not the last.
Oh, it was not.
No, I forget when that was. No, I mean it was. I had some great experiences at the Garden, though. But I saw more circuses than probably all of your viewers put together, and wrestling and stuff like that.
All right, we have a few minutes left. Another great story that you share that I want to make sure we get on here was your trip to Egypt. You had told me about, you had some amazing stories, a few of them. I don't know if anyone pops to your mind. Jordan, something in Jordan?
Well, the trip to Egypt, I was a visiting professor there in 2013, and it was quite an honor to be there. Egypt, as if you recall, was going through a revolution at that time, the Muslim Brotherhood. And when I went there, I was reminded I was the guest of the Egyptian government, and that anything I wanted to do, I had to go with them. And so I insisted upon going to Tahrir Square and meeting the leader of the revolution.
Wow.
My personality. I'm not sure he was the real leader, but anyway, he was certainly one of the theological people behind it. So we go down there. Tahrir Square was a mess at that point. I think it's much prettier right now from what they tell me. So we go down there and wait outside in this tent. And there's a few people around, a couple of guards and stuff like that. So they allow me in. Now, don't forget, they gave me a driver and a bodyguard. And we were driving a 1977 Toyota Corolla in the back because it looked unspecial. And I had a bodyguard who was a real nice guy.
Right.
And so I go inside the tent, and we kiss, which is what men do over there. And the first thing he says through a translator to me, he says, "Doctor, I want you to go back to the United States, and I want you to tell those people that this is not a religious civil war. This is not a civil revolution." He says, this is done to improve the economy of the lower classes of this country who cannot afford to eat. And he said, that is all it has to do with it. So you go back and tell America. Very nice person, and we exchanged things. But I think the other story I wanted to tell you, too, that was when we went to, there's a military museum that's very close to the Temple of Muhammad Ali. And we were... they brought me over there after seeing the pyramids, went inside, and it was really outstanding. They had swords that go back hundreds and thousands of years. They had other objects that military value that go back thousands of years. But the thing that really blew my mind was a wooden chariot that was 6,000 years old.
Wow.
I have a picture of it on my cell phone. I'm not going to pull it out now, though. So as I'm standing there looking at this thing, they come over to me and they say, the commandant of the fortress wants to speak with you. I said, okay. So before I left, they told me, two things you don't do. Do not talk about religion and do not talk about politics. Well, when I got there, all I wanted to do was talk about religion and politics. That's all I wanted to talk about. So they take me into this really ornate room with frescoes on the ceiling, with balances all around the room like that, overstuffed chairs. They sit me down with I like tea or coffee. So I figured, I guess they drink tea. I'll take tea, thank you. So I had my bodyguard with me, who spoke very good English, and then a couple of people from his staff. So a few minutes later, the commandant walks in, okay? And he get introduced to him and so forth. Here's the professor of the United States. Okay, he says, "What do the Americans think about our revolution?"
Right.
So I said, in all humility, sir, I'm not really sure that I'm really capable of expressing the opinions of all the Americans, but I think I can probably summarize it by saying that we are very proud of the fact of how well you have controlled the revolution and that you have minimized the loss of life, and I think the restraint that you showed needs to be complimented. Okay? I thought it was pretty good for me then. He says, yes, but we have already lost 2,000 people in this revolution. What do you think of that? And I'm thinking to myself, I suppose that is inevitable. You can't control all aspects of it if you want to maintain that you have law and order. I said, but just remember that in the United States, we had the civil rights movement, and we lost 5,000 people, and that wasn't even a revolution. So he looks at me, shakes my hand, and walks away.
Wow.
I said, thank you, Lord.
Right, forgive me that. All right. Like I got out of that one.
Yeah.
Well, before we go any further, we are getting close to wrapping things up here. Dr. Palamara has a birthday coming up, and so we have something special.
No.
Yes, sir. We have something special. There's a lot of meaning behind this.
I still have the one from last year, too, the Father. I have a Father Guido Soducci hat, by the way. Thank
Do you
very
really?
much. Yes,
You got
I
to
do.
bring that.
Should have brought it with the mustache.
This is
Can I have a shot of grappa first, do you mind?
absolutely. Go for it. Yeah, let's do that. Cheers. There you go. Salud.
Centani. You sure you don't want to open this? No, I was taught by my mother to try to save the wrapping paper for next year.
I don't know.
Here, Here, why don't you do it?
Oh, okay.
You know, just in case I have to do roadside surgery.
Right, you're prepared.
Good grief. You wrapped this? Oh my God.
So this is
It even looks like me. Mafia doc.
This is a custom-made minifigure of Dr. Palamara. Let me help you take it out here. He comes out. He pops out.
Oh my God.
See
Okay.
it kind of there. This is just a box to house him here.
Isn't that nice?
That was several months in the making,
That's beautiful.
and this is the little background that goes with
Oh
it.
my God. Hold on one second. That is beautiful. Just wait one second. Look, hope you guys don't mind up there too. But this is worthy of a Kodak moment. Smile, good, perfect. Beautiful.
All right. And if
Thank
you don't
you
mind,
very
let
much.
me take a photo of you real quick. So I have for me. I'll come by. Yeah, this is amazing.
They're beautiful.
Beautiful. Okay.
So that's it?
No, one last question, if you don't mind.
Okay.
This is a good one. I'm glad you like it. It took
Good.
many months to do this. And
Wow.
I gave him a photo. I'll show you later the photo I gave. I found online like the last nice professional photo you had, and the guy went off of that.
That's pretty much what it looked like, yeah.
Right?
Yeah.
I mean, he.
I should have worn my stethoscope. People know I'm a doctor.
I know. Right. All right.
Can I have my sisters back?
Oh yeah. Sorry. Well, we're really excited that you like the gift.
I do.
And
That's very kind of you.
I respect Dr. Palamara for a long time. He took me under his wing, actually, when I first met him. I'll never forget when I first met you. It was in room 2. We were doing a angio case. I believe it was in an arm. And he's never met me before. And I was relieving somebody. Maybe it was Arlene. And he turns and looks at me and he goes, "Have you ever done angio surgery before?" I said, "Yes." He says, "Well, then tell me what is the difference between balloons and the expansion and what the numbers mean." And I said, "Well, it probably means the size of the diameter of the balloon and how far it expands and a few other questions." He goes, "All right, let's go." And from there, the rest is history. But no, Doc, I do appreciate you being here and giving us your time. This is going to be online forever. And, we're living a lot longer, which is great. And my last question for you is really for you to leave a message to whether it's your grandchildren, for people that are coming up in the profession of healthcare, looking back on everything in your life and what would you like to leave people to know?
Medicine is a great profession. I am honored to have been part of it. If your son or daughter wants to be a doctor, tell them yes. There's a lot of sacrifice that goes into it. But without question, it is a very noble, probably one of the few remaining noble professions that we have. And my remaining goal is to try to put the profession back into the practice of medicine. But I can't say enough nice things about it. And as the guy used to say on Saturday Night Live, medicine, baseball been good to me, medicine been good to me.
I like that.
That enough?
Yeah, that's enough.
good.
We appreciate your time. I'm Stephen Prano. This was a Cyber Health Podcast. Go ahead, Doc.
Yeah, today's my grandson Bradley's birthday. I just want to wish him a happy birthday.
Oh, right. Happy birthday,
By
Bradley.
the time he sees this, he'll probably be a year older.
Right. We appreciate everyone watching this episode. We thank you for subscribing. I'm Stephen Prano. I'm the host here of the podcast. Dr. Palamara is our guest. Our goal here was just to have a conversation, to get things out in the open, for people to continue that conversation and hopefully make improvements. So we thank you for watching. We appreciate any feedback you'd like to give us. Take care and be well. God bless.
Thank you for the opportunity, sir.